Good afternoon to everyone. I want to thank the Foundation for a Healthy Kentucky and also want to thank Dr. Daniel Hincori for a really wonderful presentation. That was quite good. I'm Wayne Tuckson. I'm also the host of Kentucky Health on KET. And today I have the pleasure of being the moderator for this session, the influence of policy measures on vaccine rates. And looks to be a very interesting panel. We have some wonderful speakers. Our first speaker is going to be Dr. L.J. Tan. Dr. Tan is the Chief Strategy Officer of Immunization Action Coalition and the co-chair of the National Adult Influenza Immunization Summit. Dr. Tan will be speaking to us on Will Influenza Be Back and Strategies for Avoiding the Twindemic. Dr. Tan, you have the floor, sir.
Oh, thank you very much, Dr. Tuckson. And folks, LJ here, delighted to be here and thank you for this opportunity. I understand I have like about 10 minutes to get through some slides. So I'm going to do that and hope for a great discussion as we come out of the slide presentation. Okay, and so you've already heard the title and just a couple quick disclaimer slides. I have no conflicts of interest, no discussion of unapproved or investigative use of a commercial product, and a disclaimer that any opinions that I express today do not represent the official position of the Immunization Action Coalition, which is my employer, or the National Adult and Influenza Immunization Summit. And that's especially important because I do co-chair that summit with the Centers for Disease Control and Prevention and with the Office for Infectious Disease Policy at the Department of Health and Human Services. And I don't want anything I say to be misconstrued as potential policy positions of either the CDC or the OIDP. So thank you very much for understanding there. So I've been asked to talk a little bit about policy that can actually change or improve immunization coverage rates, specifically with influenza. And I think one of the things I want to start by reminding everybody is that flu vaccination coverage rates remain historically low. They're not where we want them to be. And I do have some summary slides. Of course, we all don't have a lot of coverage data yet with the last flu season. We think we did a little bit better, but that data will be released by the Centers for Disease Control in October of this year. So I'm going to just show you some of the data from the previous season, which is the 2019-2020 season, and just point out to you again, 48.4% of all adults over 18 vaccinated, only 69% of those over 65, which are my most vulnerable population, vaccinated. Only 51.4% of adults 18 to 64 years of age with a high-risk condition vaccinated. So we know these numbers are not satisfactory and they're not going to do us well with regards to protecting against the morbidity, mortality, and indeed the cost burden of influenza disease. And so some of the policy changes that we've done to try to improve coverage rates have been on sectors, right? Things where we know that we can actually implement change, ecological change, as we like to call it. And the first sector was obviously healthcare personnel. We've done a lot of work prior to the implementation of employer policies on improving healthcare personnel vaccination coverage rates for flu. And they kind of stayed stagnated at about, 70% was all we could get to. And what we began to realize that this idea of educating and making access available could get us only to like that 70-75% rate. And then at some point, it was going to stop. And what we needed was what we call ecological change. And the ecological change in terms of policy that we saw that had an impact on healthcare personnel was, of course, what we call the condition of employment, or as some people would like to call it, the mandate, right? And so what happened was a lot of healthcare facilities began to implement condition of employment policies such that if you wanted to work at this healthcare facility, you needed to consent to getting flu vaccination each and every year. And to show that that policy actually works, so the Immunization Action Coalition began to conduct and create what we call an honor roll. And this honor roll essentially is a roll call of anybody any facility, any medical practice, any clinic, and if you implement a condition of employment policy and you get your healthcare immunization coverage rates above 90%, you are eligible to be recognized on this honor roll. And to show that you can indeed implement condition of employment policies, we now have more than 1,150 national medical organizations, hospitals, facilities that are on this honor roll. And this is reflected here on this website. And as you can see, you can check out who's on the honor roll on this website. On this website, we also point out all the position statements that support a condition of employment policy with regards to healthcare personnel. And I think this is one of those things that I think has made a tremendous improvement in terms of the healthcare immunization coverage rates, because we know now, as you saw from that data slide that is on the background, If you have a requirement for vaccination, healthcare worker personnel influenza vaccination rates go up to over 90% easily, over 94% indeed. And similarly, what we're trying to do now for long-term is for create a similar honor roll for long-term care facilities, because we know that healthcare worker immunization coverage rates in long-term care facilities are not where we want them to be either. And as you can see on this slide, there are about 291 long-term care assisted living organizations that are now in this honor roll, and in the states that you see in the orange, those states actually have facilities that are now in our honor roll. And so again, share this around, have folks join us on this honor roll so that they can acknowledge that they've implemented a position statement that emphasizes condition of employment for their employees and have got their coverage rates up above 90%. So we know condition of employment works. What else works to improve immunization coverages? While this is not a policy statement, this is something, of course, we can definitely share, and that is the importance of the provider recommendation. I'm showing you the impact of data. I'm showing you data of the impact of a provider recommendation when it comes to pregnant women. And this is true broader than just pregnant women. In fact, the pediatric population has shown us that when a provider strongly recommends a vaccination, and in this case, influenza vaccination for pregnant women, you get people vaccinated. So on the far left side, you see that when a provider recommends and offers or refers that patient for vaccination, we get 75% of pregnant women vaccinated. On the other hand, if you don't give a recommendation for vaccination, you sit at a pathetic 1 out of 5, right? And so what we're trying to say here is that we need to support and we need to create policies that support the provider recommendation, not just for pregnant women. I'm just using this data as an example, but in general, right? So when you give a strong provider recommendation, we end up also being able to convince the patient to get vaccinated. And we know that as data. We know that's a fact. And this ties in with that healthcare personnel vaccination policy as well, because one of the important things is that by doing that kind of policy, you make the provider now a role model, right? It's so much easier to recommend flu vaccine if you yourself as the provider are vaccinated. So I'm going to step this up a little bit more and talk about some of the things that we have challenges with and how we need to figure out policy that addresses some of these challenges. And as we all know, influenza vaccine effectiveness continues to be the tricky messaging point to improving coverage rates. A lot of people say, hey, LJ, the vaccine doesn't seem to work, so I don't want to get it, right? So I think we need to start thinking about how do we implement policies that will improve messaging, improve education on these issues. So here's the effectiveness rate, and everyone points to this and go, hey, look, this was in the 2019-2020 season. Of course, the previous season, we hardly had flu, so we're not going to get a lot of effectiveness data from that season. But all ages, 39%, and someone will tell me, hey, 39% LG, that's not very good. But I want to point out that this is in terms of disease prevented. And I think we need to stop thinking about flu vaccine effectiveness solely in terms of disease prevention. And we need to start talking about flu vaccine effectiveness on this broader issue of preventing some of these big picture things, such as hospitalizations and outpatient visits. And as you can see, we have significant disease, not only disease prevention, but significant protection against hospitalization and outpatient visits across the lifespan. In particular, that right-hand side for the over 65-year-old patient, we are able to prevent 54% of hospitalizations in that patient group. And remember, this is a high-risk group that gets hospitalized for flu if they get vaccinated against flu. And we're able to prevent 39% of outpatient visits in this high-risk population if we vaccinate against flu. Similarly, with pediatric influenza vaccination, you can see that with the kids, if you vaccinate, you prevent 62% of hospitalizations and 56% of emergency department visits. So we need to stop just focusing on prevention of disease itself and start measuring our vaccinations in terms of the benefits that flu vaccinations can give. So we need to start thinking about strategies to communicate this to our audience out there. So if you take a look, 7.5 million flu cases prevented in the 2019-2020 season because of vaccination. That's the combined population of your state, Kentucky, and Kansas. 105,000 hospitalizations prevented, 6,300 flu deaths prevented. So we need to move towards this conversation. And indeed, for those over 65, we need to start helping them understand that when they're on this frailty curve, as you get older, as you begin to start on the top, and then as you get older, you begin to slide down this frailty curve. And at the very bottom, you're either in a walker or you're in a wheelchair, or heaven forbid, you're in a hospital bed. You don't want to get there. And the reason you slide down there is because of these conditions that happen as you get older. Inflammaging, which is a systemic inflammatory response that your body has as you age, and multiple morbidities. So these are the chronic health conditions that make you vulnerable. Things like cardiovascular disease, diabetes, chronic pulmonary lung disease. Those are all things that increase your risk of sliding down that curve. What I want to point out is that a lot of patients aren't aware that that's sitting underneath them and that it's not far, and that influenza will actually accelerate them down that curve. So when we talk to our patients, and we need to create these policies so that we can educate our patients, that when we talk to them about keeping their glass half full as they age with exercise, diet, smoking cessation, we need to add vaccination. And it's not just flu vaccination. We need to add vaccination for all appropriate vaccines to that conversation as well. Indeed, when I talk to people over 65 years of age and I encourage them to get flu vaccine every year, I ask them, if you don't get your flu vaccine, is it because you are willing to risk your independence this winter? It is indeed also a quality of life conversation. So as I wrap up, I want to remind all of us that we need to learn how to leverage flu vaccination to offer COVID-19 vaccination as well, and vice versa. So it's the you're not done yet argument, right? If someone comes in for flu vaccine, you're not done yet. Have you thought about COVID? If someone comes in for COVID-19 vaccination, hey, sir, you're not done yet. Have you thought about flu vaccination? So in that respect, reminding everybody once again that current CDC guidance indicates that COVID-19 vaccines and other vaccines, including flu vaccines, now can be co-administered without regard to timing. So you don't have to wait. You can give them at that same clinical visit. That's a really important policy change from the CDC. So because we now have loads and loads of data regarding with COVID-19 vaccines that show that you can indeed co-administer these vaccines without regard to timing. So you can do them at the same visit. Finally, just to remind everybody, this is a big policy statement that was released by the summit last month. This is a call to action to protect all adults from vaccine-preventable diseases and disability. And that is because with the COVID-19 pandemic, we have resulted in a tremendous loss in vaccination coverage rates in many US adults. 1 in 4 of US adults are only 1 in 4 US adults are actually complete with their adult immunization coverage. And so we've got 3 out of 4 who are missing vaccines. So the CDC has supported our call to action, as you can see here with this letter from the CDC. Again, asking all providers, this is the policy here. You got to assess the status of all your patients. You got to identify what vaccines they need and recommend that. That's the provider recommendation again. You got to offer those vaccines and you got to document those vaccines. And hopefully, if we work together with these standards for adult immunization practice, we will be able to get our vaccine coverage rates up, not just for flu, but for all adult vaccines. So my final slide, just to remind everybody, these are from the Community Preventive Services Task Force. These are all effective strategies to increase influenza and indeed adult vaccination coverage. Many of these you know about. It's about putting them into practice. Things like provider reminder recall, provider assessment and feedback, standing orders. All those things have been shown to improve immunization coverage rates. So I'm going to stop here, remind you of our resources. And Dr. Tuckson, I'm going to turn this presentation back to you. Thank you all for your attention and the opportunity to present.
Dr. Tan, I could have gone a long time in my life without seeing that last slide, man.
I figure it draws attention to everybody, you know?
Hey, man, when a colorectal surgeon gets grossed out, that's gross. I know this is going to generate a lot of great discussions for us. And so what we're going to do is remind everyone that to type in your questions that you have, and we'll get a chance to answer them at the end of our presentation. Our second speaker is Dr. Jennifer Cates. Dr. Cates is the Senior Vice President and Director of Global Health and HIV Policy with the Kaiser Family Foundation. She was speaking to the influence of policy measures on vaccine rates and vaccine mandates. Dr. Cates, you have the floor. Thank you, ma'am.
Thank you. It's good to be here, and I'm glad I get to follow that great presentation because I'm going to talk about specifically about issues of mandates and other policy incentives that can influence COVID-19 vaccination rates, which a lot of which are similar to what we just heard about for flu, but there are some differences. So I'm going to share my screen here. All right. So what I'm going to cover briefly as I can is more of this sort of background and what can be mandated, and because vaccine mandates are in the news constantly right now. So I'm going to look at questions about the federal government's role and ability to mandate, state governments, private employers, if there is a mandate, what exceptions must be considered, and kind of what we know right now about the status of mandates, and finally a little bit about what the public thinks. So very briefly, I think the two general questions that come up when thinking about the federal government's role in mandating vaccines, one is, can it do so for the public at large, for you and for me if we aren't federal workers? Is that possible? And it seems unlikely that the federal government has the authority to issue that kind of broad-based requirement. There are some potential legal avenues for doing so, and I included them on this slide. But in general, it's not something that has been tested in the courts in that broad sense, and it's usually seen as something that a state or local government would do. However, and as we're all experiencing now, it is possible that the federal government can do so through employers under certain conditions, and I'll get to that. In terms of workers, federal workers, yes, this has already been upheld. Prior to COVID, this was already upheld in court for the military. The government already has the authority to mandate that immigrants seeking to enter the US get certain vaccinations. And so it's generally been thought that this could easily be applied to federal workers and contractors. In terms of the state and local government authority to do mandates, this is actually even an area that has a lot more legislative and legal history. The Supreme Court upheld the state vaccine mandate over a century ago in a case that anyone working in this space would probably be aware of, Jacobson v. Massachusetts. It has also upheld the authority of a state or local government to condition school attendance on vaccination, which is why many schools in the US, not all, but many, will actually all mandate some form of immunizations. So the general landscape, given this, outside of COVID, is that children, in all states, children do have vaccination requirements. Adults, there are some, and as we just heard about, the main example of that is in healthcare workers and sometimes patients in healthcare facilities. There are always exceptions and accommodations that are required by law, and I'll get to those as well. And can employers mandate vaccines? Yes, some private employers have done so in the past for influenza, usually in healthcare settings. But interestingly, states, just like states can mandate vaccination for certain employees in certain places, they can also prohibit employers from instituting vaccine mandates, something we also are seeing around the country. Employers also may be subject to collective bargaining agreements that require that they negotiate before imposing a mandate. And as I said before, exceptions and accommodations are required by law. These are the two general exceptions under the law. Medical accommodations, there are some individuals and for certain vaccines where their doctor or the current public health knowledge says that it's contraindicated for them to get an immunization. And in that case, they must be allowed an exception. And there's also an exception for religious accommodations, which are defined fairly broadly. But if a employee brings forward a sincerely held religious belief that would conflict with the requirement to get vaccinated, they are able to request an accommodation. So where are we today? As you probably are aware, the federal government, President Biden recently instituted a federal workforce mandate. Vaccines are now required for federal employees and federal contractors. These are the two executive orders that were issued by the president mandating these, and these are going to be rolling out. They've already started. And I just want to point out that in both of these cases for federal employees and contractors, the requirement is vaccines. Unless you meet a medical or religious exceptions, there's not a testing alternative. So this is truly considered a mandate, a vaccination mandate. In terms of state mandates, it's quite variable. This is as of a few days ago. There are 21 states that are requiring mandates, at least in some cases, for primarily public employees and some section of the public. There are 11 states that have actually prohibited an employer or anyone else from mandating vaccines, and 19, including Kentucky, do not have a provision in place at all. Some that have mandated vaccines also have allowed for a testing alternative. That's if someone says, I don't want to get a vaccine, but I will agree to like a weekly or biweekly testing. And as I mentioned before, medical and religious exceptions are always required. Now, the employer mandate status is quite interesting, and this is just a recent change to my slides on this, because prior to, this is what was in place until very recently. The EEOC had come out and said that employers certainly can require a COVID-19 vaccine in the workplace. And they also talked about how employers can incentivize employees to get vaccinated, that was okay as well. And this is their guidance. And in part because of this, and also this, I think, reflected what was already happening. We now know there's hundreds of colleges and universities that are requiring a growing number of private employers, but there are many legal challenges to this underway. And as I showed in the prior couple slides, several states have passed laws saying employers cannot mandate. But interestingly, what recently happened is the federal government took action regarding private employers and also healthcare workers. The president came out and said that OSHA, which sets workplace standards, was going to use something called the Emergency Temporary Standard to develop a rule that will require all employers with 100 or more employees to require vaccination or have a weekly testing alternative. And also that employers must require time off to get vaccinated. And if someone has any kind of side effects, that they have to accommodate that. This is being challenged in court, including by 24 attorney generals right now. So it's, I think most legal scholars, I am not a lawyer, but most legal scholars believe that this can withstand legal challenge because of the emergency temporary standard, but we'll see. In addition, already for certain healthcare workers, the administration has required vaccination without a testing alternative, and this was expanded by the president. So now any healthcare facility, any setting that receives Medicare or Medicaid reimbursement, which is virtually all, are required to have a vaccine mandate. In terms of the private sector landscape, I think I just pulled out some of the bigger companies just so you can see which companies have already announced and have instituted vaccine mandates. Not all of these are true mandates. There are some companies that are allowing for a testing alternative, but some are strict, get vaccinated, but unless you have an exception, medical or religious exception, you must get vaccinated to work here. So I'm going to turn just for the next few slides to a little bit about public opinion. That's something that my organization tracks pretty regularly. These are some recent data just over time looking at the share of the public that has gotten vaccinated, at least one dose, or says they will, or is saying, no, I'm not going to do it, or I'm only going to do it if required. What we see is that there's about 14% who say they definitely won't, and that's been pretty constant. There's a smaller share that's saying only if required, and that's because more and more places are requiring it. However, what we find in our surveys is that people are split on whether their employer should require. About half say they should. That means half say they shouldn't. And this varies according to different demographics. So Democrats are more likely to say employers should require it than Republicans. And people who are vaccinated are much more likely to say, yes, employers should require it than those who aren't. We also asked about other kinds of incentives that could be helpful. And interestingly, people were less supportive of cash bonuses or other kinds of incentives to employees for vaccination. We did ask workers specifically if they wanted their employer to require, and most said no, although vaccinated workers were split. And I hope you'll get these slides. So if you want to look more closely, and we also have tons of other data on our website. One of the things we did ask was what about paid time off and being encouraged to get vaccinated? And what we found is workers who did have paid time off or were encouraged were more likely to be vaccinated. We can't say that that is causal, but it suggests that that is something that really does lend itself to people getting vaccinated when their employer makes it as easy as possible and also encourages it. And then finally, we've been surveying parents, and we also similarly found that when parents say their child's school is encouraging COVID-19 vaccination or providing information, they're more likely to say that their child is vaccinated. So I think putting all of this together, it kind of suggests that mandates and other forms of incentives are really important. We heard that in the case of flu, and they seem to be helping increase rates, which had been stagnant for a while. But I think we're all living a little bit in a natural experiment, and we'll see how it plays out.
Thank you very much. That was fun. Right now, we're going to go on to our third address and final speak, and that's going to be from Ms. Kate Shanks. Ms. Shanks is the Senior Vice President of Public Affairs for the Kentucky Chamber, and today she will address vaccinations from the employer perspective.
I just want to thank everybody for having me here, and I have to say it's probably important to say who I am not. I am not a physician, nor am I an attorney. I am a lobbyist for the Kentucky Chamber of Commerce, the Senior Vice President of Public Affairs for the Chamber. I've been with the organization for about 6 years now, and I have to be honest with you all, when I joined several years ago, I never thought that I would ever be speaking so much about vaccinations. You know, early on, I think it was something that, you know, we talked a lot about in terms of wellness programs. You might get $20, $25 to get a flu shot. I recall there were a couple of years when our local pharmacist would come and you could roll up your sleeve and get your flu shot for the year. It was a convenience thing. But we never really talked so much about, you know, the policy behind vaccination and the rights of employers to vaccinate. And that has certainly changed quite a bit. And so just thinking through, you know, the employer's role in vaccination, it's never been more significant, I think. Outside of the healthcare setting, where maybe there was always this role in terms of vaccinating for the flu and other viruses, maybe in certain other workplaces there may have been specific vaccinations. Really, this is something that is new in terms of the scope. And the fact that we have all sorts of businesses of all sorts of sizes representing different sectors of the economy that are saying, hey, you know, we need your advice and we need some guidance on what we need to be doing to vaccinate. Early on in the year, in January, when the vaccines came out, it was a whole lot of information about what are these vaccines, how do they work, what do we need to know to help our staff understand. Then it was a conversation about who gets these vaccines, where do they get the vaccines, what kind of job do you have to be in to get these vaccines early. And then it started to transition when the vaccines became readily available as, well, how do we get our workforce vaccinated? The ones that are not comfortable doing it, who haven't gotten vaccinated, can we provide incentives? And then, of course, can we mandate it? As those conversations continued, we started to hear a lot about policy and just the general discussion about employer rights, which we, of course, advocate for versus the individual and what their decisions are for vaccinating. So I'll talk a little bit about the considerations that businesses may have in terms of mandating vaccines. What I always tell policymakers is this is not a decision that they make lightly. The decision to mandate the vaccine or any vaccine is never taken lightly by an employer. It's based on a very thorough understanding of the perspectives that their employees have, the type of facility. It's a case-by-case type decision, and they're really looking at the pros and cons for their individual workplace. I think in terms of the pros or the reasons why you would want to mandate the vaccine, of course, the very first one is about public health and public safety. How do I keep my workforce safe? And how do I keep the people that we serve safe, especially if you're in a healthcare setting and you're taking care of people who may have very serious medical conditions. Second, I think that they're also looking at the workforce challenges that we have. In Kentucky, we lost around 300,000 people at the height of the pandemic. We've recovered about 2/3 of those, so we're still down about 100,000 people. And so, you know, we're struggling right now with workforce. We are ranked 48th in the nation for workforce participation. We have lots of jobs open and not enough people to fill them. And so when you think about illness in the workplace or quarantine and how quarantine affects your already strained workforce, that's certainly something that has to be taken into consideration. And so they're thinking about that quite a bit. And then I think they're also thinking about individuals that may have compromised immune systems. How do I protect my staff that might be vaccinated, but they still have potentially health problems? Or how do I, as I mentioned, protect the people that I serve and care for that might have compromised immune systems? And then on the flip side, why an employer may not want to mandate, because that's still a choice that they're making, they're thinking about, of course, just the general controversy of it. We've seen people in the parking lots of hospitals holding events where they're protesting against vaccine mandates. And they're also thinking about workforce. And you have to balance the fact that could you potentially lose people who don't want to become vaccinated? And how might that affect the facility? And so these are not easy decisions. They're not decisions that are taken lightly by employers. But it's certainly something that's being discussed. And then we hear a lot about incentives. And I know Jennifer mentioned that already. Lots of employers are providing paid time off. There's certain, I think, tax credits still available for certain size businesses that do this. I know employers, we had a webinar at one point where one employer was registering people for vaccines. So they took care of all of the administrative work for you. They had an HR director doing it. And then we had a program we launched recently called COVID Stops Here, where we wanted to recognize employers that had reached 70, 80, and 90% vaccination rates among their staff. And if you had hit that 90%, your staff could be entered into a drawing for all sorts of wonderful prizes. And so, we're doing a lot of that work. Employers are doing a lot of that work to create those incentives. I think the question is, at what point have we come as far as we can with incentives? And I know I've seen some polling recently. I think that the Foundation for Healthy Kentucky did that looked at, what percentage of people who aren't vaccinated are still willing. And there's still that room there. There's still an opportunity to get those people vaccinated. And so perhaps the right combination of incentives with education and information is just what we need to get people moving along to vaccinate. Special events and large gatherings is another area where we're seeing this happen. I went to a concert recently where I had to show my vaccine card. I thought, great, finally something I can do with this card that's been sitting on the shelf. Or you had to show a PCR test. So we're seeing more and more of that at big events. But I've been to events where, that wasn't the case. And of course, I'm masking and doing other things in a crowd. But, it's kind of hit or miss at this point. But I think more and more you're seeing those larger events that are requiring some type of vaccine or negative test. Employers' rights. I know Jennifer touched on this, but I will simply reiterate her point that yes, employers do have the right to mandate vaccines. And there are, of course, those exemptions that she laid out specifically about sincerely held religious beliefs, as well as, your medical situation. And then also simply asking vaccine status as well is also allowed if that's just the simple ask. So this is the core piece of the employer rights that we, that are legally there in law in Kentucky. It may have been changed in other states, but in Kentucky, that we are very much working hard to protect, because that is crucial for employers to be able to make those decisions that are specific to their facility and their workplace to stop the spread of COVID-19 and protect their staff and the people that they serve. So very important. We are seeing legislative attacks on employer rights, and we're seeing this in multiple states. My counterparts in other states are discussing it. We started the Kentucky Coalition for Employer Rights during the special legislative session that was earlier in the month. And we went out and we were very clear with legislators that these bills were anti-business and that were problematic, and we worked to kill those bills, and we will do so in the upcoming 2022 legislative session. I think any attempt to erode employers' rights, especially when we are still in the throes of a pandemic, is very problematic, but also for the future. We need to have those rights, and we need to have all the tools that we can to stop these pandemics, should there be more variants of this one and more viruses in the future. We also saw legislation that was punitive in nature that would have prohibited an employer from accessing funds that were going to be made available for tackling COVID-19 if they mandated the vaccine. These are problems. These bills are problems, and we will continue to work against them. We've also saw some legislation around workers' comp, which I'll talk a little bit about as well. And then the newest development is President Biden's announcement on the emergency temporary standard that's related to vaccine mandates, calling on all businesses with less than 100 employees to mandate the vaccine or weekly testing. There's still a lot of unknowns about this. He has directed the U.S. Department of Labor to issue that emergency temporary standard. Once it is published, it takes effect. It's in effect for a while until it's replaced with a more permanent rule that allows for public comment and comment periods and things of that nature. And so it could likely be in effect for several months. And we are hearing it will be published in the coming weeks, not months, not days. And so we have a lot of questions about this. We do have some concerns about how it would work. We think it could be problematic. Specifically in just the practicality of it and how it's rolled out, how the testing will work. Will there be enough testing? And we want to make sure that this rule is as least burdensome on businesses as possible, because we are coming out of a period where, businesses have been hit hard over and over again by this pandemic. And so rulemakings, such as the emergency temporary standard, need to be as least burdensome as possible so that we aren't hit back even further as we continue to recover. And then the last thing I'll talk about are the COVID-19 liability protections that we put in place during the 2021 legislative session, Senate Bill 5, sponsored by Senator Robert Stivers from southeastern Kentucky, Clay County. And it was legislation that provided liability protections for claims arising from COVID-19. And this was in addition to all sorts of potential claims that did include services, treatment, and other actions performed to limit and prevent the spread of COVID-19, which we believe would include vaccines as well. The bill was sort of reauthorized, re-up as in House Joint Resolution 1 during the 2021 special session. And so it will continue to take effect until January 15th. And we will continue to advocate for extending those liability protections when we come back into session in January. Also, the PrEP Act of 2005 created the Countermeasures Injury Compensation Program, and the COVID vaccine is part of this. And so if you did develop some side effects or some issues from the vaccine, there is that federal recourse you can take in terms of getting your condition, taken care of. And then I mentioned workers' compensation, and we do understand that if you mandate the vaccine and it's now a condition of employment and you do have an adverse reaction to the vaccine, it could be a workers' comp claim. Workers' compensation, but we don't believe that those laws should be extended in any way, such as to include workers' compensation claims or the ability to file a claim if you've been given an incentive by your employer, or your employer has encouraged it or has helped you get the vaccine. We don't believe that the workers' comp laws should be extended to do that. So this is just really a general overview of what we're seeing from the employment side. Again, never in my life have I talked more about vaccinations, and did not expect it to be the typical course of action for us at the Chamber of Commerce. We're usually working on taxes and infrastructure and workforce issues. But COVID-19 has certainly required a lot of new work from us, and we will continue to advocate for businesses as we navigate the current situation with the pandemic. So with that, Dr. Tuckson, I believe I'll turn it back over to you, and thank you all so much for the opportunity to provide those comments.
Okay, thank you very much. And if you would, since you now have the microphone, I have a question before we get to some of the several questions we have. And I want to start with you, then I'd like Jennifer and then LJ to respond afterwards. As you're probably aware, the Washington Post reported just, I think it was yesterday or the day before, that one of the health insurers, United Healthcare, has now decided they no longer going to cover the costs associated with COVID infections. So that people will now be hit with not only paying their co-pays, but they're going to be stuck with some of the hospital bills and ICU bills. And as you can well imagine, these are going to be huge for these patients, So now, if you think about the number of employers that have their own self-insured plans, is this going to be an incentive for those employers now to get their employees vaccinated? And I'll piggyback into a question someone asked. They wanted to know what were the most effective policies, programs to raise immunization rates, mandates, incentives, or a combination. Seems to me that this is going to be the biggest one when people now have as our previous governor said, skin in the game. You're now going to have to pay for these high costs. You address that first, and then we'll go on to Jennifer and LJ.
Yeah, thank you. That's a great question. I think I saw too where an employer was going to be charging more for health insurance for those who who hadn't taken the vaccine. And you know what it makes me think of? It makes me think of smoking and how that has impacted health insurance costs and healthcare costs. And so I think these are really good questions and really good issues to bring up. I mean, employers are facing rising healthcare costs, and we have this opportunity to take these vaccines and stop the spread of COVID-19, and people are still getting really sick, and young people who are in their prime years to work are getting really sick and are in ICUs and of course on ventilators, and those costs are real, and they're accruing, and it is a problem. And I will tell you, employers see COVID-19 as like enemy number one. I mean, it has to be stopped. And so I think that you'll continue to see, as we've seen incentives, and then we've seen some mandates. We'll see what happens with the ETS. I think there's question about legality of it. Will it be challenged in the courts? But as you see more and more options being used, and we still have a segment of the population that's reluctant to do it, to get vaccinated, I think you're going to see more and more policy decisions made by employers who are like, we can't keep doing this. We have to stop this. We have to stop this pandemic. Until we do, our economy is not going to fully recover. We're going to struggle with schools closing down. We'll struggle with workforce shortages. And I think they're going to be very serious in using all the tools that they can.
Jennifer, please respond. Unmute yourself.
Yeah, and I agree. We actually have looked at this issue. I think what you're talking about is there's two things. One is the waiving of no longer covering treatment costs. Mm-hmm. So insurers were waiving those costs for quite a long time, and we did analysis at KFF showing that many were stopping that coverage. And I think that's going to be a rude awakening for people that might be faced with those costs when they have them. And so that could also lead to people getting vaccinated. And then this other issue that Kate mentioned as well, where some are moving to charge higher premiums for employees that don't get vaccinated. So these are within the rights at this point from what people what I've seen for insurers and employers to do. And so it's just another way in which different there's carrots and sticks with incentives. And some are carrots and some are sticks. And I think at this point in the pandemic, we're seeing a few more sticks come out. And maybe some less carrots, but I think there's a question in the chat, and I think both are still important, carrots and sticks.
Hope you hit somebody over the head with a carrot, it'll hurt, I promise you. LJ, please.
Oh, thank you very much. The great conversations. I'm just going to add one final thing, and I think I just want to remind all of us is that this idea that to get out of this pandemic, both for health as well as for the economy, we need to stop transmission. And I think to stop transmission, some of these policies that we've been discussing are probably the most effective way to do this, right? So this, again, this idea of putting skin in the game with premiums, I think that makes a lot of sense, because reminding everybody, COVID-19 is now a vaccine preventable disease. So it's now not in terms of disease severity, but it's like flu, it's like measles. We can stop this thing with a vaccine. So it makes absolute sense policy-wise for an insurance company to say, hey, if you're not getting vaccinated, I think the costs have to be borne. And I think that makes a lot of sense to me. So, and then as we talk about this, as we do these mandates, as we talk about the condition of employment, so I think one of the things I want to reemphasize, though, is you can't just slap on a policy change like that. I think you want to think well, as you said, Jen, about how you implement. And part of that implementation is access. You got to make sure that the employees that you're going to ask to get vaccinated have access to vaccine.
All right, let's go the other way around. Conway Regional Hospital in Arkansas said they'll let anybody opt out for religious reasons from taking the COVID vaccine. But he said, I want to see how committed you are. You have to sign a form saying you will also opt out of taking 30 other medications that were all developed using fetal cells, Tylenol, aspirin, ibuprofen, et cetera, et cetera. So LJ, is that calling people's bluff and say, okay, now what is your reason for not doing it? And is that something that an employer can use?
I think that's really, really, that's cool. I think that's a real a stick, if you want to talk about sticks, right? I just want to point out firstly, just to correct it, COVID-19 vaccines, no the fetal development part. We've already gone through all that. It's not the issue there. But I do say, I think if we're going to offer either religious and heaven forbid what we call personal exemptions to vaccination, those exemptions should be serious. For religious exemptions, minimally a letter from a pastor, a priest, a religious leader that testifies that in their religion, not in my little congregation, but in my religion, vaccinations are indeed forbidden. And if you think about that, very few religions, in fact, I can think of only one, actually prevents or prohibits vaccinations, right? So, and that's obviously the Christian Scientists. I think most people will find it challenging to find language prohibiting vaccinations in the scriptures, because remember, vaccines came far after a lot of our scriptures were developed. So I think, yes, please, if you're going to do an exemption, make sure you have teeth behind that exemption.
Jennifer, please.
Yeah, I think this issue of how to handle exemptions is a tough one. And some places, the example you gave is maybe calling bluff and providing, asking employees to really think and consider, is this something that is truly about a personal belief or a religious belief, or is it something else? Some places are having employees sort of describe what their, some places just have simply, I have a religious a belief against this, or a personal belief, check. Other places are asking for more of an explanation. And one you provided is a very strong one, but just having people write down what their belief is and why it conflicts with this. And I think it's a tough place for employers to be in, though, how to figure this out. And I think, as with everything with COVID, we're asking people that don't normally work in public health to do a lot of public health.
Kate, what do you think? Has Conway Regional Hospital got to wait for you to provide cover for your employers?
We did a big liability webinar on this topic several months ago now about, how do you handle these exemptions? And, how can you ask for documentation? At what point are you running up against ADA considerations? And so I think, I'm not an attorney, and I'm always careful to say that. I think we do rely on some of our labor attorneys to kind of walk us through that. And I mean, it's a very fine line about how you manage the religious exemption and how you manage the medical exemption and what you're allowed to ask and not ask. And so I think I'll leave it at that and let people kind of work with their attorneys. And if you want to reach out to me, Shanks@kychamber.com. I can send you a link to our liability webinar that we did a while back that might help shed some light on that. But, that is a tricky thing. And, we did have legislation this past year to change the wording to conscientiously held beliefs, which is anything. So, we opposed that. So, that was difficult. But, right now it's a very narrow focus.
Since you have the floor, and I want to answer, we got to probably a little quicker. We got about 5 minutes more to go. Keith Knapp asked a question: wouldn't acceptance of Medicare or Medicaid dollars make an employer at least quasi-federal employer? And I wonder if he's referring back to, Jennifer, correct me if I'm wrong, with the Hill-Burton Act. If you took federal dollars, you had to follow the federal health care policy by allowing African Americans and other folks into these hospitals. So if there is a precedent for the federal government saying, if you're going to take our dollars, you've got to follow our policy. Is he on to something here by asking, is this a quasi-acceptance?
Well, yes and no. So already, there's not just the precedent that you mentioned. Already, the federal government has said that first they started with nursing homes, nursing homes that had Medicare and Medicaid had to institute a mandate for nursing home employees. And so those aren't federal nursing homes. Those are private, in many cases, they're private nursing homes, but because they get reimbursement through the federal government through these two very important big programs, they have to abide by this to get that reimbursement. It's not federalizing them. It's saying as a condition of receiving these funds, which frankly they need to receive or they can't survive. And the president in his recent announcement just expanded that to virtually all healthcare facilities. But again, that's different than Could the federal government condition? I don't think employers are in the same position. General employers are in the same position. It's really a fairly unique that is applicable to healthcare facilities because of Medicare and Medicaid. But I'm not an attorney, so I don't know if there's another way to do that. Certainly, the way that the president has chosen to do it is through OSHA and the Emergency Temporary Standard for private employers. And I think there's a whole different set of regulatory and legal requirements and issues around private employers versus healthcare facilities, even though there's overlap.
Kate, there was a question that asked, do employers have a legal obligation to protect their employers? Do employers have to protect their employees from preventable disease by requiring vaccine? You kind of touched on that. Can you give us a 2-minute extra answer?
Yeah, I think that's one of the considerations that they have. If, let's say you have an individual with a compromised immune system that's vaccinated, but is still concerned about the effects of COVID. So then you start getting into situations of accommodation. And again, not to be a labor attorney, but this is where you'd want to be pulling in some of your HR experts or your labor attorneys on how to handle that. And can you provide an accommodation for that individual who's saying, you know, I've done everything I can do. I need to continue to work from home, or I need to not be in this environment where I'm around people who aren't fully vaccinated. I'm driving in a car. I mean, these are tough issues that employers have been dealing with now for 18 months. And they dealt with this before the vaccine. And now there is a vaccine where they could be getting this relief, and they're not. And so I think that's why you might see employers that are thinking, okay, is it time to mandate this? Is it time to deal with this? Because you're right, that is a consideration. How are you going to protect those? And then how do you protect your patrons? Perhaps you're, in an education facility and you've got students that can't be vaccinated yet. What if they have health conditions, and do you provide virtual school for them? I mean, it is an endless.
Let me ask, I got LJ, I got to get him a question. LJ, earlier we heard Paige Mankiewicz said they talked about providing $100 gift cards for people as an incentive. Steve Stiver said he's going to give coupons for Crazy Bread. You tell me. But anyway, so tell me, would a bigger incentive be, since we now see that insurers are going to start taking away the copays, I mean, they're going to start making the employees start paying for things again, would a better incentive be that, hey, if you do all the things they ask you to do and you stay healthy, you'll get a chance to benefit from the savings we have from our healthcare cost?
Yeah, I think that's actually a very positive way to do that, because we're already seeing that, right? With participation in physical exercise, in preventive behavior, many employers are saying that we'll take some off your premium, for example. I think that's a very positive way to encourage that form of to incentivize that kind of behavior. I do worry when we talk about these gift cards of $100 or lottery tickets, because we're now that is incentivizing what I would like to consider socially normal behavior. I think getting vaccinated against a vaccine preventable disease that's devastating our country should be a social norm. So we shouldn't be having to incentivize that. I get why we're doing it, but I sure would like to see us move away from that and moving towards something that's a little bit more typical. Insurance premium discounts, for example, would be one way to look at that. So yeah, absolutely, Dr. Tuckson.
Well, I want to thank you all very much. And I can't think of anything else that is more of an incentive for people to get out there and get vaccinated. We remember every day, 1,500 Americans are dying from COVID-19. We just had 9/11. So that means every 2 days there's a 9/11. 1 in 500 Americans have died from COVID-19, disease and or complications. You tell me whatever it is going to take to get everybody incentivized to show up and get something done. I will be waiting. I'd like to thank you all very much. Dr. Tan, Chief Strategy Officer, Immunization Action Coalition. Dr. Jennifer Cates, Senior Vice President, Director of Global Health and HIV Policy, Kaiser Family Foundation. And Ms. Kate Shanks, Senior Vice President of Public Affairs, Kentucky Chamber. Thank you all for being with us today. And thank you to the audience. Carry on. Thank you.
Thank you.
Thank you.